Assalamu alaikum. It's really a pleasure to share in Endo Isma, and thanks for the kind invitation of Professor Ihab Salim. And in 2022, we are talking a lot about monoclonal antibodies that are used in different branches of medicine. And it was time for us in endocrinology to talk about the relation between thyroid and monoclonal antibodies. And when I tried to prepare, so it came to my mind one case we have seen 30 years ago. This gentleman referred to us from the ophthalmology department for the queer diagnosis of Graves' ophthalmopathy, as you can see. And this is the lateral view of the eyes of the patient with proptosis and some periorbital edema. But the question is, this patient has really Graves' ophthalmopathy, and you can see from the CT we have done in 1993 that actually there is no Graves' ophthalmopathy, but there was a bilateral mass in the orbit. This was lymphoma presented as proptosis bilaterally. While in patients with Graves' ophthalmopathy, typically they have the thing of the medial recti, while in comparison to the normal, but this patient has got retroorbital lymphoma. The second instance is a paper we presented back 15 years ago in the International Congress of Endocrinology in Rio de Janeiro, and we described the association between thyroid dysfunction and patients with chronic hepatitis C, whether they are treated with interferon and ribavirin or not. And we found that almost 1/4 of the patients, they have got a different form of autoimmune disease. And almost 6 years later, the Italian group has published the idea that autoimmune thyroid disease can be associated with hepatitis C, associated with cryoglobulinemia, which is a form of monoclonal antibodies. The next 30 minutes, I'm going to go through the path of this presentation, giving a short introduction, and then going to the ideas that monoclonal antibodies, they have been used in the diagnosis and treatment of thyroid disease, that monoclonal antibody treatment sometimes can lead to thyroid disease, and that the presence of antibody can lead to false diagnosis of thyroid disease. And lastly, is the relation of monoclonal gammopathies affecting the thyroid. The short introduction is that the monoclonal antibodies actually have been described back in 1975 by George and his group in Cambridge, UK. And nowadays in 2022, there are several molecules of monoclonal antibody used not only in the diagnosis, but also in therapeutics, in the field of cancer, autoimmune disease, cardiovascular disease, as well as hypercholesterolemia, and even infection. So we have to remember the monoclonal antibodies, now they are commonly used these days. The second point is that monoclonal antibodies, they can be used in the diagnosis of thyroid disease, like the famous association of Hashimoto's thyroiditis with monoclonal antithyroglobulin antibody, and also that the TSH receptor antibody, the novel third generation monoclonal antibody, have been used also for the diagnosis, as you remember, in patients with Graves' disease and this. The second point is that treatment of thyroid disease, particularly thyroid eye disease. As you see, this recently introduced drug that Prof, which is monoclonal antibodies against insulin growth factor receptor. And you can see this has been very, very useful in improvement in the orbital pain, eyelid swelling and erythema, as well as conjunctival redness in patients with thyroid eye disease. Thirdly, that monoclonal antibody treatment, whether the treatment of autoimmune or disease or infection or cancer, can lead to thyroid disease. I am quoting this paper. It's not the only paper, but there are hundreds and thousands of paper relating the different monoclonal antibodies, like the alemtuzumab treated for multiple sclerosis. And mind you that any drug ending with MAP, this is a monoclonal antibody, of course. So this publication is considered that the high incidence, almost 1/3 of the patient treated with lemzotumab that got a high incidence of thyroid dysfunction, and the mechanism, of course, is by autoimmunity, and it can lead to Graves' disease, thyroiditis, subclinical thyrotoxicosis, or even hypothyroidism. And some of the patients, they do have the thyroid disease with no symptoms, and you treat this patient. Of course, you try to stop the drug if possible. If not, you have to treat with different medications. Sometimes in severe uncontrolled hyperthyroidism, you can give the antithyroid drugs, radioiodine treatment, or even surgery. The first problem is that sometimes monoclonal gammopathy can be associated with false thyroid diagnosis. I'm quoting this interesting publication about a 54-year-old lady presenting with fatigue, and the lab showed a normal TSH, normal T4, free T4 is within normal, while a T3 is very, very high. And of course, this false measurement is due to certain basic lab work. If you are interested in revising the methods we are using to measure the different hormones, we've got the different types of immunoassay, like the two-sides immunoassay or the competitive immunoassay. We are using what we call antibody against the analyte. Analyte means the substance we are using, we are measuring. So if there are different heterophilic antibody, they can give to false high and sometimes false low measurement of thyroid hormone. So we have to remember this point, very, very important. Last but not least, is that monoclonal gammopathy, or diseases associated with abnormal monoclonal antibody, can affect the thyroid. I will start with the multiple myeloma, which is a famous clonal malignancy of plasma cells, which is characterized by overproduction of monoclonal antibodies. And the multiple myeloma can be associated with autoimmune disease like thyroid autoimmune disease. Secondly, the lenalidomide, which has been used for the treatment of multiple myeloma nowadays, increases the risk of autoimmune thyroid disease. Thirdly, sometimes multiple myeloma, when it is extramedullary, or what we call the plasmacytoma, can be presenting like a mass, can present like thyroid swelling. And this plasmacytoma sometimes can be solitary, even without bone marrow affection. And it occurs in about 12% of primary cases of multiple myeloma. First important relation of multiple myeloma to thyroid is that chronic lymphocytic thyroiditis, the so-called Hashimoto thyroiditis, can predispose to multiple myeloma. And these are a couple of papers. This is the first one, and this is the second one, discussing this association that the autoimmune thyroid disease can be linked to increased incidence of multiple myeloma. You have to remember that very well. Second important monoclonal gammopathy is the primary amyloidosis. And primary amyloidosis can mimic the Graves of Gammopathy. And this is one of the patient published by Einstein in 2016. And you can see that the left eye, this is the inferior rectus, left inferior rectus is much sickened by primary amyloidosis, leading to abnormality in the eye, mimicking Graves of Gammopathy. And also the relation of amyloidosis and the thyroid is very interesting. Like this patient is a 16-year-old lady presenting with recurrent euthyroid goiter. And when she was supposed to have surgery, the Forsan section showed query medullary thyroid carcinoma. Why that? Because medullary thyroid carcinoma in the histopathology, there are patches of amyloid tissues. But actually the final diagnosis was amyloid goiter, not medullary thyroid carcinoma. So again, amyloid goiter can mimic in the pathological specimen medullary carcinoma of thyroid. This is an important clinical implication. And the majority of amyloid goiters are secondary to chronic inflammatory conditions, but less common can be primary, what we call the AL amyloidosis, not the AA, which is secondary. Third association are the lymphomas. Thyroid lymphomas, primary thyroid lymphomas are uncommon. 5% of thyroid neoplasms are due to primary thyroid lymphomas. And usually it does occur in middle-aged women with a background of chronic lymphocytic thyroiditis. And patients with Hashimoto thyroiditis, they got a 40 to 80-fold risk of having lymphoma. And it presents with euthyroid, rapidly enlarging, diffuse or nodular goiter. The fine needle aspiration, sometimes it can help, sometimes not. Ultrasound is not conclusive, but the isotope scan shows cold patches. So you have to know this association. And this is the pathology. You can see that there are patches of beta cell lymphoma on top of Hashimoto thyroiditis. The last association between monoclonal gammopathies and thyroid is a rare association of monoclonal gammopathies and thyroid cancer. Like this paper presented in 2010, there was a case report of patient with monoclonal gammopathy associated with papillary thyroid carcinoma. Not only that, but another patient with one-strom macroglobulinemia, which is a form of monoclonal gammopathy, was associated with medullary thyroid carcinoma. So, dear colleagues, ladies and gentlemen, at the end of my short presentation, I was trying to make a brainstorming of the association of the monoclonal antibodies, which is rather a very commonly used terms in 2022, whether in the diagnosis and treatment of different disease, and have shown you that the monoclonal antibodies are used for the diagnosis of thyroid disease, namely the Graves and the Hashimoto. They are used in treatment of thyroid eye disease like the teprotumumab. The monoclonal antibody used for treatment of different conditions, whether tumors, infections, or autoimmune disorders, or cardiovascular disorders, or even dyslipidemia. All this monoclonal antibody can be associated with thyroid disease, whether in the form of Graves or thyroiditis or hypothyroidism. Fourthly, that the presence of monoclonal gammopathy releasing antibodies can affect the assay and can lead to false thyroid hormone measurement. Last but not least, is that the monoclonal gammopathies, like, as I mentioned, lymphomas, amyloidosis, and as well the condition of multiple myeloma, all this condition can lead to affection of the thyroid and sometimes the rare association with thyroid carcinoma with autoimmune disorders. And I'm really happy to share in the Esma conference, and thanks to the effort of the organizing committee and to the effort of Professor Ihab Salem. And thank you very much for your patience with me. And I'll be happy to answer any question. Unfortunately, I couldn't be there with you physically, but maybe next year, inshallah, we'll be sharing together. Thank you very much.